Hello, welcome back to this channel. Today the topic of our video is routes of drug administration. That is an important topic in general pharmacology. So what is drug administration? A route of drug administration is the path by which a drug, fluid or any other substance are taken into the body. Remember, there is no single method that is considered to be ideal for all drugs in all circumstances. So what are the determinants of routes of drug administration? That means the factors that would determine whether which route of this drug has to be taken. These determinants depend upon or related to drug. That means that includes solubility of drug, whether the drug is lipid soluble or water soluble, pH of drug, whether it is acidic or basic pH, stability of drug, for example whether the drug is stable, would be stable in gastric pH and environment or not, irritancy of drug, whether the drug would be irritant to gastric mucosa or not if taken orally. The therapeutic objectives related to determinants of route of drug administration include whether we need a rapid onset of action of drug, that means we need the drug to act immediately, for example in emergency situations, so the route of drug would be different, for example intravenous. Whether we need long-term treatment of drug, the route of drug would be different in that case, and whether we need the delivery of drug to the local site only, then the route of drug would be different, for example topical route. So the routes of drug administration are divided in basically in two categories, enteral and parenteral. Transdermal included in parenteral or categorized in other categories. In both ways it can be categorized. Enteral include uh, oral, sublingual and rectal, while parenteral include injections, inhalations, topical and transdermal. So first we will discuss enteral routes, that means through the gastrointestinal tract, and these include oral, sublingual and rectal routes. So first route is oral route. That means when the drug is taken by mouth, and it is the most common route of drug administration. Oral preparations can be enteric coated, that would be stable in gastric environment, and extended release preparations. There are some advantages of oral route, that are it is the safest route, it is most convenient route, economical, self-administered. That means a patient can itself take the drug by mouth. It is pain-free, non-invasive, and there is no need of sterilization of any type of equipments because it doesn't require any equipment. So there are also some disadvantages of oral route, that include the absorption would be slow, so the action of drug would be also be slow, so the drugs cannot be used in emergency situations. The drugs would have a bitter taste that would be objectionable in some patients. Food can affect the absorption of drugs that would be present in gastrointestinal tract. Some drugs can be destroyed by gastric juices, for example adrenaline, oxytocin, and it cannot be used in uncooperative and unconscious patients because the patient would not be able to take the drug by itself. In oral route, drugs can cause gastric irritation, and drugs would be metabolized before systemic circulation. That is the first fast effect that we have discussed in the last video. That means the drugs are first absorbed or taken by portal circulation into the liver, where they undergo metabolism, and then they are available for the systemic circulation. So the dosage forms of oral route include tablets, capsules, syrups, powders, spansules, emulsions, suspensions, and elixirs, that are sugar containing alcoholic preparations. So the next route of drug transmission administration is sublingual or buccal route. In the sublingual route, the drug is placed under the tongue, and buccal route, drug is placed between the gums and inner lining of cheeks. In this route, the drug is rapidly absorbed by the capillary network into the mucosa. So there is rapid absorption and rapid action of drugs. So this route can be used in some situations, in emergency situations. The examples of drugs include glyceryl trinitrate, that is used in case of angina, buprenorphine, and des-aminooxytocin. So the advantages of this route include, as we have discussed earlier, the absorption would be rapid and action of drug would be rapid. And as it in this route the drug would not enter the gastrointestinal tract, so it would bypass the first pass effect and bypass the destruction of gastric acid, and the drug stability would also be maintained because it would not enter the gastric pH, and the pH of saliva is neutral, and it is economical, and patient can also self-administer. So there are also some disadvantages of this route that include the drugs would have unpalatable bitter taste, and they would cause irritation of oral mucosa, and in this route only a few drugs can be taken by this route, and only small doses can be taken by this route, and drugs would not be completely absorbed if the drug is swallowed, because it would enter the gastrointestinal tract and then would undergo first pass effect, and absorption would not be complete. So the third route of enteral type include rectal route. In this route, drugs are administered rectally as a suppository or retention enema. The drugs would enter the lower portion of gastrointestinal tract, but they would bypass the first pass effect. Examples of the drugs that are taken by this route include diazepam, aspirin, indomethacin, theophylline, chlorpromazine. So the advantages of rectal route include, as we have discussed earlier, it would partially bypass first pass effect and would bypass destruction by stomach acid because they would not enter the stomach. They are not taken orally. And it is the route that is ideal in case of children, in case of unconscious patients, and if the patient is vomiting. And it is ideal if the drug would cause vomiting. So the disadvantages of this route include it is inconvenient for the patient and also the provider. Absorption would be slow and erratic, and it may cause irritation to rectal mucosa. So the other type of route of drug administration is parenteral route. That means the route other than gastrointestinal tract or alimentary tract. In the parenteral route, drug directly enters into the systemic circulation. So the first type of parenteral route include injections, and these are the types of injections that can be administered that include intravenous into the vein, intramuscular, subcutaneous, intradermal, intraarterial, intraarticular, that means into the joint, intracardiac, intraperitoneal, into the peritoneal cavity, intrathecal, and intramedullary. This picture shows the angles while injecting different types of injections. First is intramuscular, that is injected at an angle of 90 degree to the body. Next is subcutaneous, that is injected at an angle of 45 degree into the subcutaneous tissue. And next is intravenous, that is injected at an angle of 25 degree into the vein, and intradermal at an angle of 10 to 15 degree into the dermis or skin. So first we would discuss intravenous route of drug administration, that is the most common route or in case of parenteral route of drug administration, in this route the drug is directly introduced into the vein and systemic circulation by a syringe. Advantages of intravenous route include, as it is directly injected into the vein, it would enter the systemic circulation immediately and would have immediate effects. It would have 100% bioavailability, and it would be used in emergency situations, and it would bypass the first pass effect because it would not enter the gastrointestinal tract, and it would be ideal for irritant drugs. It would be ideal if dose is large in large volume, and dosage titration would be possible if we are using infusion, and it would be ideal for high molecular weight proteins and peptides, and it would be ideal in case of unconscious uncooperative patients and those having disturbed GI motility in which the oral route is not suitable. Disadvantages of intravenous route include, as it is an invasive route, so it would be administered by a skilled person only, and that would need strict aseptic technique, and it can cause pain and irritation at the site of injection, and a bolus injection can cause adverse effects also, and it would be unsuitable for oily substances, and most substances would be slowly injected. Next type of parenteral route is intramuscular route of drug administration, in which drugs are directly introduced into the muscles by syringe. Common sites of muscles include deltoid muscle of shoulder, gluteus maximus of buttocks. In this route, aqueous solutions are rapidly absorbed and depot preparations are slowly absorbed. So intramuscular route also have some advantages and disadvantages. It is preferred over IV because in this case a patient can also self-administer, and it is suitable for oil-soluble drugs, mild irritants, depot preparations, suspensions, and colloids. While disadvantages include, it would be painful, there are chances of formation of abscess at the site of injection, and there are also chances of nerve damage if it is injected in the area of nerve, and it can alter the result of certain lab tests, for example creatine kinase, because this enzyme is present in muscles, and large volumes of drug cannot be administered by this route as in case of IV. Next route is subcutaneous route. In that route, the drug is administered into subcutaneous tissue. Examples of drugs that are administered by this route include insulin for diabetes and heparin for anticoagulation. Advantages of this route include, it would be suitable for slow release drugs, and it would be ideal for poor soluble preparations, and patient can also self-administer by this route. Disadvantages include, pain and necrosis can occur if the drug is irritant. It is unsuitable if large volume of drug has to be administered. Next route is transdermal route. In that route, drug is introduced into systemic circulation by the application of a patch containing drug on the skin, on the surface of skin, and then the drug is absorbed by from this patch into the skin and then the capillary network of systemic circulation. Examples of the drugs that are administered by this route includes polamine for motion sickness, nitroglycerin, and estrogen patches for HRT therapy. HRT. So the advantages of transdermal route include, it is convenient, it is painless route. It would also bypass the first pass effect because it would not enter into the gastrointestinal tract. It would be ideal for drugs that are lipophilic and have poor bioavailability. It would be ideal for drugs that are quickly eliminated from the body. Disadvantages include, the patches are expensive. They can cause local irritation if patient is allergic to the drug, and there would be slow and delayed delivery of drug to the site of action or the pharmacological site where the action has to be performed. The it is limited to drug that must be taken in small daily doses, and patches may also fall unnoticed. Next route of drug administration is inhalation route. By this route, the drug is administered through the respiratory system in the form of gas or vapors. Types of this route include oral inhalation, in which bronchodilators and corticosteroids are given orally, and nasal inhalation, in which decongestants, corticosteroids, and desmopressin for in case of diabetes insipidus is given by nasal inhalation. In the inhalation route, it is used for the treatment of some respiratory diseases, for example asthma, and in case of general anesthesia. So the advantages of inhalation route include it has rapid action, it is ideal for gases and suitable for respiratory problems. Doses can be titrated, and it would have fewer systemic side effects. Disadvantages include there can be difficulty in using inhalers by some patients, and difficulty in regulating the dose by using inhalers, and this is the most addictive route. So the last route of drug administration is topical route. But in this route, there is application of drug directly on the surface of skin or any mucous membrane, and by the skin it is absorbed into the systemic circulation of the local area. It is used when local effects of drugs are desired. So these are the dosage forms of the topical application. On skin, we can use creams, lotions, ointments, transdermal patches, shampoos, discs, and gels. On eyes and ears, we can use solutions, suspensions, and ointments. And in nose and lungs, we use sprays and powders. Thank you for watching this video. Stay tuned for watching upcoming lectures of general pharmacology.